Good afternoon. I'm Carol Dixon. I'm with the Idaho Federation of Families for Children's Mental Health. I would like to welcome you to our June parent webinar. Today we have Jennifer Eason Barnett, who is a licensed clinical social worker with the Department of Health and Welfare, the Division of Behavioral Health, and she's going to present to us today on mental health crisis planning for youth and families. Jennifer's been working in the field for about 15 years, so she has quite extensive experience working with children and families. I think the information she's going to present is going to be incredibly valuable to the families in our community, both here in Idaho and outside of the state. It's hard when families go into crisis. There's a lot of uncertainty. There's not knowing who to reach out to and what is available. So I think this presentation will be extremely beneficial. If you have questions, we have a chat box that's on the side, so please write your questions in. What I will do is at the end, I'll collect those and I will bring them out to Jennifer so that she can address those towards the end of the presentation. I want to let you know also we have coming up very quickly in July, it's actually the July 6th is our webinar called Strong Families, and that's going to be presented by Maureen Durning, and that is an emphasis on looking at the 5 factors that protect you from being overwhelmed, you and your children from being overwhelmed by the stress, and to help your children thrive. We also have for our August webinar is Worn Out, Failure, Tired, Parenting, and Disruptive Behaviors, and that's being presented by Brian Huck, who is also a licensed clinical social worker that's at St. Luke's. So with that, I want to turn it over to Jennifer. Thank you very much for joining us today, and I'm looking forward to what you have to share.
Thank you, Carol. Thank you for having me, and welcome everyone for joining us today on mental health crisis planning for children and families. Just wanted to give you a little beginning talk about what we're going to be covering today. We're going to be looking at recognizing and identifying what a crisis means for the youth and family, looking at some warning signs, addressing how do we go about making a crisis plan, and possible interventions to be able to develop for you and your child when you are in a time of crisis. One thing particular to note is that a crisis plan is definitely intended to be used as a proactive measure in times of crisis, and you don't have a plan ready and able. Safety is the number one important factor for you and your child, and I'll just say this at the beginning that when in doubt, reach out with, call 911, take your child to the emergency room to be able to receive the help that you need at that moment. So back on to crisis planning. Understanding what a crisis is, the warning signs, or strategies to de-escalate the crisis that may be occurring for you and your family, and all the available resources are important elements to a crisis plan. And one of the things that we want to make sure that everyone is understanding is that crisis is something that is dependent upon your child and your family. You're going to know when your family is in crisis, and it may not necessarily be that they're actually at risk of harming themselves or harming another person, but that your family is experiencing such distress that some intervention is needed at that moment. A mental health crisis exists when there's a need for immediate action and intervention, and that the child, the family, the environment is no longer safe for that child or the family. Let me switch my slides here. There we go. Crisis situations are very stressful, and they're come at moments in our lives when we can least expect them. And the purpose of a crisis plan is to be able to give yourself a tool to be able to think with a clear head and be able to know how to respond to your child to ensure safety, but then also for your family to move and transition through that crisis so that healing can happen. Again, like I said earlier, crisis planning is a proactive way to be able to assist in returning the child and family back to a better level of functioning. and it's individualized. It's based on what is important for you and your child when there is a situation that brings into question safety. It's based on your strengths, it's based on your preferences, and all the resources that you may have within your reach. Let's switch slides here. There we go. So you might ask, well, what would be important? The important reason to be able to develop a crisis plan. I can just take my kid down to the emergency room. One of the most important reasons would be that kids and families need to be supported in the least restrictive environment. Oftentimes, I've had families communicate to me that just even going to the emergency room is such a stressful situation, and it changes the crisis in a different way and increases the level of stress for the kid and the family. And it really, at times, can change the focus away from really the issue that needed to be addressed to begin with. And it becomes focused on whether they need to be hospitalized or not, and it diverts the family from really addressing the crisis. And so it's really important to have kids in an environment that is supportive to them and the family. Crisis plan is a way to be able to identify positive ways to prevent escalation. If a plan allows for a kid and a family to intervene before you get to the point of needing to go to the emergency room, then that is a successful plan. It will also help you to identify, well, what are the next steps? A crisis has happened, so what does the child and family need to do following that crisis? It provides early intervention and supports. It can assist in identifying supports that maybe wouldn't normally be thought of in a crisis. Perhaps there is a spiritual member in the family or in the extended family that can be helpful and supportive in a time of crisis. Or maybe there is a place where that child or youth can chill out for a little bit. A crisis plan really is something that can allow for a creative process to happen in identifying places, supports, interventions for that kid and family to move forward from a crisis. And again, it's a plan that belongs to that child and youth. It's typically developed in conjunction with a more formal support at the child's therapist, the school, or another, maybe a family support partner that would be able to help the family to do some problem solving around how to be able to intervene when that crisis occurs. Another important part about that crisis plan is it's a living document. A crisis plan needs to be updated following a crisis if there were some barriers to that plan being successfully executed. But it also should be reviewed to identify any additional supports or resources that may be helpful to that child and family in a time of crisis. So some of the important factors to consider, let me switch slides here again, is the best time to develop a crisis plan. When a child is escalated and is in the heat of a moment of a crisis, again, that is not a time to start talking about, well, what do you need right now? The purpose of the plan is to have it ready to go. It's attached to the refrigerator. A family can go to it, get it right away, and go, okay, this is what we need to end up doing. It allows for them to be able to execute it without any barriers. So you want to make sure that the child and family are in a good space to be able to talk about when I start to get angry, or mom does this and I respond this way, how can we come up with a plan to not have or prevent the crisis that may end up occurring? It definitely is a plan is to help them identify what are the instances in which a crisis occurs. What are the elements that might be influencing that crisis, or situations that could be avoided, be prevented, etc. We want a crisis plan is going to look at situations in the past. What worked? What didn't work? And as I said earlier, it's a plan is something that's going to look at all different resources that child and family may have available to them and see about being able to incorporate them into assisting in a time of crisis. And the ultimate goal of a crisis plan is to help kids and families to remain safe and in their home environment. That's where kids do best, that's where families will do best. Oops, I skipped one. Let me go back here. Sorry about that, guys. So here's some ideas to start thinking about when you're looking at a crisis plan. When a child is needing to start developing some ideas for that crisis plan, we're going to want to help them with what happens inside of you when you know you're starting to get angry or upset, or we're headed towards a crisis that happened. What are the signs that I'm okay or I'm not okay? I've been sleeping well. I am doing good in school. That's when I know I'm doing okay. And on the other side of it, I'm not sleeping well. I haven't been doing well in school. So what are then the early signs? Let's start at the very beginning of that crisis plan. What are some early signs that the kid is not doing okay? Changes in sleeping habits. Maybe they started to have one night a week where they were struggling with sleeping at night. Maybe they started to isolate in their room a little bit more, or have been describing a few more worry thoughts than what is normal. The kid is going to then want to look, the kid and the family are going to want to look at what can they do to feel better. And they may or may not have already identified some of these coping skills to be able to improve and change some of those feelings that they may be experiencing. But they also might need some extra support to be able to develop and come up with a list of things that they can do to help them to feel better. The other part of it is it's a plan that's based on the family. So what can mom and dad do? What can the teachers do to be able to help them to adjust, to cope with some of the stressful feelings that are occurring for them? Neighbors, teachers, who's the therapist, probation officer, listing all of those resources that are involved in that kid and family's life, and what it is that they specifically need from that resource to end up improving the feelings that they're experiencing and turning the tide of the crisis that may be happening. It's also really important to include in that plan things that are not helpful for that child and family. Many families that I have worked with and talked with, they describe, it's not helpful having a police officer come over to my house in a marked police car. That sends my kid through the roof. I need a police officer in an unmarked police car. Making sure that that information is provided to all of the resources available in that kid's life, school, probation, perhaps maybe reaching out to the local crisis team through the regional mental health center, letting them know, hey, we've got this going on, my kid tends to get into crisis, and it would be important for you guys to know, please don't send over a police officer in a marked car. Another important part of that crisis plan is times when I know I need help. School. Right after school is the worst time ever. What is going on for the kid right after school that ends up escalating the really intense feelings, and they end up resulting into a crisis? So looking at what times of the day that crises tend to happen, what happens before, what happens afterwards, and really narrowing down in that crisis plan how to be able to intervene for that child and that family so that they can be prepared for when a crisis ends up happening. So let me switch here. And as I'm talking here, if you have some questions that come along, please feel free to, I'm ahead. Please feel free to write them in, and I'll be happy to answer them as they come in. If I'm making sure I'm here. I'm going to stop here in terms of the cycle, and let's talk about some of those warning signs And these are some clinical signs that end up happening for kids or families, because families also experience this as well. So some of the warning signs that a crisis may be happening for kids and families to look at would be they've started to not do things that they normally do. Their hygiene has changed. Maybe they're not keeping up on their chores like they used to. Maybe their schoolwork has declined. They start to have more mood swings, more aggressive behavior. There's more agitation, irritability. There's actually evidence or symptoms of psychosis that may be occurring for that child. They're isolating. Maybe there's actual suicidal ideation or homicidal ideation. Those are very, very acute symptoms that might be occurring there. Or unexplained physical symptoms. Maybe they're a little more somatic. I've got so many tummy aches going on. And then obviously a big key factor in disruptions for kids or kids showing that they're in distress is changes in the sleep patterns. Those are some of the clear warning signs that crises or the kid is in crisis, experiencing crisis for them, and may result in crisis also for the family. Some family symptoms to keep in mind is you might be noticing that as a parent, you're starting to react a little bit more. You'd gotten things pretty even keel in your parenting, and you're noticing that you're reacting to your child's symptoms a little bit more. Your anxiety may be increasing, or you might notice that you're getting a little more irritable as well. You might be noticing that you're having to take off more work because there just seems to be more symptoms going on that you're having to then attend to your child's needs. All of those are good warning signs and to keep in mind for when crisis is looming, and a good reason to have a crisis plan in there. So again, looking at in that crisis plan all of the factors that might be involved, not just what's going on with the kid, but what are you experiencing as a parent? What is the school noticing? What are the siblings noticing? How are they feeling about how things are going on? And really important, all of those pieces need to be part of that crisis plan so that every part and piece is addressed to help prevent future crises. So let's go on to, we've got our faces up there. So this little diagram here is just a little graphic. It's something that you can take away and be able to show to your child and to help them to kind of work through as you're developing your crisis plan. Sometimes kids work better with faces like this. And so you can help them to map out what that crisis cycle looks like. And this is where you're breaking down all of the pieces that would go into that crisis plan of, I'm at the very bottom with that smiley face, the baseline. I'm in control. Things are going good. I know I'm doing well. And what's the reason why? So listing that information. And then it moves up to something triggered me. So you might see the little triggered face, and then you see that it escalates. And then up at the very top is the crisis. Oh my goodness, we're in crisis there. And then something, what is it that we can do to de-escalate? So you see the arrows going across there in that graphic. What can we put in that space between that escalation and the crisis to start looking at de-escalating? And then writing down for you, what helps you to manage your triggers? How can we stabilize and bring the crisis down? And then the post-crisis crash. And I'm sure many families know there is a crash to crisis when kids are so escalated and the family is experiencing that crisis along with that kid. You might see your kid getting really tired, needing to go and sleep for several hours at a time. That's not necessarily the time to talk with the kid about what has happened in that crisis. Kids are not oftentimes in that post-crisis crash not cognitively able to discuss with you what happened and how to prevent. So really understanding what your child's cycle is, how the family fits into that piece, as well as looking at all the triggers that might be going on and coming up with an actual plan or document to be able to use when crisis does happen. All right, let's talk about doing that crisis plan here. For family members, some things you might want to consider are what's the parent notice when child or youth is really calm and happy. Just again, clearly describing all of the events that might be occurring, so that you can put in the plan interventions to be able to help your child. How they look physically. Most families know when my kid has this one look, I know what's going to go on. And then to identify those interventions and actions. And most parents or caregivers have got those. It's an immediate reaction. I know when my kid looks this way, I know what we're headed for. But sometimes it's very helpful to be able to verbalize that, not only for when you're in that time of crisis, but for other people that might be assisting you in that crisis. If it's not written down and verbalized, it might be very difficult for people to know how to be able to intervene. And we know that in times of crisis, it's very hard for people to cognitively go, I know I need to respond this way, because we are in our flight or fight mode. And so if we have it written down, others can be able to support you in that crisis. Really important in that crisis plan is a list of numbers, making sure not only do you identify, Sally Joe can be helpful to the family, that's the neighbor down the street, but having her number. If someone was to come over and assist you in a time of crisis and you're not able to verbalize, I need to get a hold of this person, having it available, listed on the refrigerator for you, or some moms like books of their kids' information together, having that crisis plan with all of those numbers listed so people can support you during that time period. So if we go on to some common elements in a crisis plan, what does it look like? Again, this is a plan that's based on the child's and the family's strengths and their resources, as well as the needs that are there in the time of crisis. Clear demographic information needs to be included in there. Name, age, their diagnosis, their working diagnosis, medical history, really important. And then really their strengths and interests. If an outside person is trying to support a family in a time of crisis, and we just have all of these needs that are listed, the diagnosis or challenges that youth may have in whatever situation, it might be difficult for an outside person to be able to know how to be able to start to engage with that child and youth. But if they know that this child likes Hawks baseball, they can start to talk with them about the Hawks baseball and actually get the child to start to de-escalate and move away from the crisis that may be at hand. So clearly listing what are those kids' strengths, what are the things that their interests are, and the things that they enjoy. Family information, parent, caregivers, sibling names. If a kid is talking about a sibling, to go, well, no, that's my sister. They're not going to be thinking about that. They're just going to be talking about their sister. And so clearly marking in your crisis plan who is what their roles are. Behaviors. That's where I started talking about listing all the challenges that happen for a youth in crisis. What happens when? What do they look like? So what are all the behaviors, triggers, symptoms that may be occurring in a time of crisis, and all of the specifics around it. When do we notice this happening? When are kind of peak times of crisis? Any medications? Medications are really important to note, particularly if there's been any changes in medications, as though medication changes, and kids often being very sensitive to medications, being able to have their listed when different changes happened, because they can be a trigger to a crisis. Treatment choices. What has the family used as far as treatment interventions? Who are they currently seeing as a provider? What has worked? What has not worked? Again, it's very important to have those preferences down there, treatment interventions that have been used, so that an outside provider coming in and assisting the family, they're able to not duplicate something that has definitely not worked. We want to not put the family through more distress, by attempting something that has clearly not worked. Professional involvement, who's currently involved with that child and family, supports safety concerns. Are there specific situations? Are there specific words? Are there specific smells that may trigger the child to escalate even further to where safety is at a higher risk for that child and that family? And then really important on the end is, what's recovery? What does the picture look like for that child and that family when that child is starting to de-escalate and come to that post-crisis period? How can support outside of that child and family assist them to get to that recovery post-crisis period? And what does that family look like when they're back to equilibrium? Let's see, there we go. I'm hoping that's managing a mental health crisis. When a family is in crisis, everybody's role in that crisis is really important. That's why having a plan outlining what the roles will be in the crisis can be of the utmost importance. Children and youth, oftentimes adult, we can't communicate. It just doesn't work. We get into that fight or flight mode, and we're not up in our logical reasoning part of our brain, so we often don't end up communicating most effectively what it is that we need and how we need help to be able to return to an improved state of functioning. And so being able to have that listed out, making sure that a parent or caregiver, like I said, can point to the refrigerator, there's our crisis plan, this is how we need you to help. Sometimes, even in this time period, when the kid has escalated up and they are only responding in a flight or fight type of response, and the family is responding in kind, it can leave families very scared and confused and unsure of which way to be able to go. And sometimes they need a little extra support or direction. But having that spelled out in that crisis plan, mom really needs some extra support, or dad is the strong one in these situations. How do all the roles play out for that kid and family? If as a parent you're in a crisis situation and it's time to actually move to perhaps an emergency room, or you've identified a place for that youth to go, such as a respite provider. It's really important to decide, is safety of the most important aspect here, that I can transport this child without me being endangered or other community members being in danger, because the child is impulsive and will react that way based on the level of the crisis. So if you do not have someone to support you in transporting them to your identified place, emergency room, respite provider, or whatever's identified by that child and that family, contact your local authorities. Have them assist you. Provide them with your safety plan or your crisis plan, and have them assist you in enacting that crisis plan. It's also important when you're going into the emergency room, say that is the location that you are headed to, it's important to be able to provide the emergency responders with that crisis plan, because it's something that you guys have written prior to the crisis plan, and it clearly spells out what you'd like your wishes are in terms of when you're experiencing a crisis as a family. It will give those emergency providers an opportunity to have some of that information, so that, again, they're not going to be doing something that is against your wishes for your child and your family. It gives them a window into what you guys experience, but it'll also give them some insight as to, this is how we need to best support this family when they're in crisis. So again, managing mental health crisis. We're back on another one of those. Nope, that's not. Yep, that's it. Okay. So safety is number one when you and your child are experiencing a crisis. When when you are in that situation, if you feel you need to go to the emergency room, please go ahead and enact that and ensure that safety happens for you and your family. So contacting 911, asking for law enforcement assistance. In certain areas within the state, you are able to ask for psychiatric emergency teams, and that is here in the local Boise area. But you know what's in your area. Go ahead and contact your emergency providers, and they can assist you with what direction to be able to go. Let them know that you're needing assistance. Let them know that you have a youth with a mental illness or a serious emotional disturbance, and ask for somebody that is trained in mental health crises. When you're providing information about the incident, be specific. What happened? What is going on for that child? What's going on for your family? What's the level of risk for your child and your family? The police officer is likely to ask, what's your child's diagnosis? What medications are being taken? If they've been hospitalized at all, or if they have any legal history. Their perception is going to be very different than perhaps the perception of the emergency responders there at the hospital. And so they may ask some questions that may not be directing you towards resolution of the crisis. They are going to want to come in to take over and to ensure that there's safety for your child, safety for you, and public safety. And so some of their questions may not be, you may not feel to be the most helpful. Fear not, provide them with that crisis plan, and ensure that you've been working on to address this, and have them assist you to where you need to end up going. Keep in mind, like I said, that once 911's been called, that enacts the police and the emergency professionals, and they take over and are in charge at that point. And as a caregiver, you can encourage and advocate for the officers to view the situation from a mental health point of view. It's not a guarantee that may happen, and that's why a crisis plan can be very helpful and supportive to you in those types of situations, because it clearly outlines what works, what doesn't work, what your wishes are for your child and your family. And then we come to a post-crisis. Let me see if I got there. Nope. There we go. When the crisis has started to simmer down, maybe you guys have had a disposition at the emergency room, and you are returning home with your child. It's been decided that he's to return home. It's really important to have a period of reflection. What happened? Did my crisis plan work? Did we get executed the way that I would like it to happen? Was there more harm done for my child? Did the crisis plan work? It's important to debrief with your child, connect with your community provider that you may be engaged with, or your medicine provider, to discuss what occurred during that crisis, so that the plan can be revisited and you can end up addressing any roadblocks or barriers to the successful execution of that plan, and that child remaining in the least restrictive environment. It's important during that post-crisis debriefing that you pull together all your resources again that helped you to develop that plan, and to discuss and reflect on how can we prevent that crisis from happening again in the future, or managing it in a better way. So instead of having to get to the point of calling the police officer, we were actually able to enact and have our child go to the respite provider, and he did well at the respite provider. It's again a good time with your medicine provider to review medications. A change in medication happened and the kid went through the roof. We're not sure what to do. They didn't change the meds at the emergency department, but we're back in here seeing you, medicine provider. We need some help because I don't think that was a good change. please write down concerns. Boy, we started this on the crisis plan, and we started going down this road, and everything was working well, but we tried to help him use these treatment interventions that community provider or therapist worked with my child on earlier, and it just didn't work. So take that back to your treatment team, your community provider, and discuss with them and say, this really is not where we're going. I think we need to change his treatment plan. And it's advocating for your child that during a time for crisis can be very difficult, very exhausting, very draining. So reassessing how can you, as a parent or a caregiver, get the help that you need. Do you need some extra support? Would it be helpful for you to have a family support partner involved in your child's care and treatment? Would it be helpful for you to seek out your own treatment to get some extra support? It's also important in those times of crisis, if a resource is identified that could have been helpful, making sure that those whatever that resource might be, is brought into your crisis plan, and appropriate, releases for confidentiality and your privacy is protected through that avenue. So ensuring that you can advocate for your kid in the time for crisis. So there we go. Okay. So here's some other possible interventions that might assist you in a time of crisis, or tools that can assist you. Collaborative problem solving. It's a method in which the child and parent work together to identify any skills that might be deficient or unsolved problems for whatever reason. And this might be a problem-solving method that can be best done with a more formal support, like a therapist or family support partner, someone to give you some additional support to flesh out and work through the problems and come up with an alternative solution to what had occurred previously. So one way to start with this is identifying what skills may need a boost or need to be worked on, and any unsolved problems. This work is out of Dr. Green, and it's through his website is here on the slides here, livesinthebalance.org, and it's in the section called paperwork, so you can get some additional tools there on how to do the collaborative problem-solving method. Motivational enhancement therapy is a type of therapeutic intervention that you can seek out with your community provider, and it's can be used in family therapy, and it can be used as a way to engage a child in a time of crisis. It's called the LEAP method. And Dr. Xavier Amador, from his book, I'm Not Sick, I Don't Need Help, talks about this method in a time of crisis. Another option that families can employ during a time of crisis is to pull together a crisis kit. And that would be to be used when crisis occurs. Some items you could include in it would be your crisis plan, your medical information, snacks, books, music, change of clothes, hygiene supplies. If you know you're going to be at the emergency room, sometimes those waits can be really long and you've got to take other siblings with you. Put some activities in there for the kids to be able to use while you're in the process of being a support there for your child that is in the emergency room. Other options to put in there may be PRN medication. Sometimes prescribers will prescribe a PRN medication to help the child to de-escalate, if that is an option for you, including that there in your crisis kit. All the tools that you could need wherever you're going to be in a time of crisis. Let's see here. A few more other intervention tools. Let's see if I got it. Okay. Really important is being familiar with some de-escalation skills. If you're working with a community provider, talking with them as you're developing your crisis plan about different skills. And it's not just that you write them down, and oftentimes we Many people are guilty of going, oh, okay, I've got it. But if you haven't practiced it, you may not be able to employ that skill during an actual time of crisis. So practicing, even if it's just breathing for you so that you can get settled down and be able to think about what's the next step. So learning some deep breathing techniques or helping your child to employ some deep breathing techniques. It's important to keep in mind that a workable plan, a living plan that's modified as changes are made for that youth and that family, such as medications, behaviors, or the child is developing and getting older. So what worked for them at 9 years of age may not work for them at 13. So making sure that this plan is a constant evolving plan, and it will assist that child and family through the developmental stages that occur. The other part is also making sure that you have an individualized treatment plan. If you are working with a community provider in psychotherapy or family therapy, ensuring that your treatment plan works with your crisis plan. It is not helpful for kids and families in crisis if the treatment plan is going in one direction and the crisis plan addresses issues in a different direction. That's very confusing for kids, very confusing for families. And so making sure that your community provider, you're talking regularly about that crisis plan and what has worked or has not worked. And I've included on these slides here some additional resources, some website links for you. And then at the end are some sample templates. There we go, there's one of them, of crisis plans. They don't need to be this involved. Really, again, it's something that fits for you and your family. But it is, in this sample, you can see there's very clear people that are indicated that can be helpful for you in a time of crisis, as well as what are the different parts and pieces that need to be part of that plan. What does a kid need? What does the family need? What does the neighbor, what's their role, and how they can be helpful. And again, just some additional templates here. So that concludes our talk about crisis planning. Just as a last bit reminder is a crisis plan is not a safety plan. It is a tool to be used to prevent crisis, to help to de-escalate, and help families move towards improved functioning. Again, if your child the risk of safety to themselves or others is high, please seek out help at the appropriate, with appropriate emergency responders at the emergency room, or support from your police and fire. Thank you, and have a wonderful day.
Jennifer, I just want to say thank you.
Sure.
Lot of valuable information. Want to let everybody know that the slides to that, you can find that at the idahofederation.org under our parent education. There is an area there where you can click on to the webinar PowerPoint slides. They're in a PDF. So that's things to refer back to, because that was a lot of information that was covered in a brief period of time. But I think it's super valuable. And to me, I think what I heard you, the biggest point is to be prepared, to do this in advance, because you're not going to crisis plan in the middle of a crisis. You're just trying to get to the end of a crisis. So, taking the opportunity, review a lot of that information, look what works for your family, bring in the resources that you need to, so that you've got it in your back pocket if you need it.
Wonderful.
Yeah, thank you much.
Sure.
Again, we will have this one posted in our archived probably next week. There is probably a year and a half worth of webinars. So there are topics on multiple areas of concern for parents that you probably can find some really good resources on. So I'd encourage everyone to check out. That's idahofederation.org. And again, it's under our parent education, small section where you just kind of stick your name in there, hit submit, and it will pop up to what the library currently looks like. So again, this will be posted soon, and then we'll move into our July. On July 6th will be our next one. So thank you for joining us. Thank you very much for being here. Kim, who's over in the corner, who helped with the creation of the material, thank you very much for what you've done in terms of getting this to us. And we'll